Comprehensive Guide to Gout Essential Knowledge for Healthcare Professionals. Welcome to this in-depth module on gout, a prevalent form of inflammatory arthritis. This presentation is designed to equip healthcare professionals with a thorough understanding of gout's epidemiology, pathophysiology, clinical manifestations, diagnostic criteria, and current management strategies. Gout affects approximately 1 to 2% of adults in developed countries, with a rising prevalence over recent decades. This increase is attributed to factors such as dietary changes, higher rates of obesity, and an aging population. Gout is characterized by the deposition of monosodium urate crystals in joints and tissues, resulting from chronic hyperuricemia. Elevated serum uric acid levels can lead to crystal formation, triggering inflammatory responses and acute gout flares. Key risk factors for gout include male gender, obesity, hypertension, excessive alcohol consumption, diets rich in purines, chronic kidney disease, and certain genetic predispositions. Patients typically present with sudden onset of severe joint pain, swelling, and erythema, most commonly affecting the first metatarsophalangeal joint. Without appropriate management, gout can progress to chronic arthritis and tophaceous deposits. Definitive diagnosis involves identification of monosodium urate crystals in synovial fluid. Clinical prediction rules and serum uric acid measurements can support the diagnosis, but synovial fluid analysis remains the gold standard. Acute gout flares are managed with nonsteroidal anti-inflammatory drugs, or NSAIDs, corticosteroids, or colchicine. Long-term management focuses on urate-lowering therapy, or ULT, to prevent future flares and complications, with allopurinol being a commonly prescribed ULT. Encouraging patients to adopt lifestyle changes is crucial. Recommendations include weight loss, limiting alcohol intake, and reducing consumption of purine-rich foods to help manage serum uric acid levels. A comprehensive understanding of gout's pathophysiology, risk factors, clinical presentation, and management is essential for effective patient care. Staying informed about current guidelines and evidence-based practices will enhance treatment outcomes. For more detailed information, consult the latest guidelines from the American College of Rheumatology and other accredited medical sources.